I'm Dr. Sajid Maqbool, and I'm a pediatrician with a little bit of experience taking care of children, both when they're well as when they're sick. Today I'm going to talk about care of the newborn, and actually, before I do that, I thought it would be appropriate to talk about pregnancy first. So, when a young lady gets to know that she is pregnant, there are a number of things that she needs to do. One, of course, is to decide about her obstetrician. It is one of the most important decisions she's going to make, because not only will she carry her through pregnancy, but also decide on where the delivery is going to take place. The next thing she has to do is to make sure that she informs the doctor about any underlying conditions. Now, this includes something as simple as allergies. Also, if there is any ongoing lung problems, for example, asthma, if there are any kidney problems, urine infections, for example, or in other instances, if there are any hormonal problems, for example, the thyroid, or if she has some other condition. It could be a heart condition, it could be an intestinal problem, it could be a joint problem. So the doctor who's going to take care of you should know all this. The obstetrician will then examine the lady first, and after examination, after confirming the pregnancy and the state of the fetus, she will then advise you to take a number of precautions. One, of course, will be to take adequate diet, which includes a full range of foods, meaning fruits, vegetables, cereals, milk, meat. There will be some foods that she might ask you to avoid, for example, fish, especially those that may be contaminated with mercury, but by and large, a full diet is encouraged. One that involves not overeating, but eating about 4 times a day. The second thing that she will probably want to do is to make sure that you're getting enough vitamins and iron. In our country, there are a number of vitamin deficiencies that young ladies have. It could be vitamin A, it could be vitamin D, it could be vitamin B. Certainly folic acid needs to be given. And of course, most young ladies in our country will have some form of iron deficiency. So iron also needs to be given. In addition to this, one is advised to take enough rest, which is very important, but also to be physically active. Now, you can't be over-exercising or over-indulging in physical activity, but normal physical activity is very, very helpful to the mother as well as to the baby. So that needs to continue, and you need to consult your doctor about if there are limitations imposed for this particular pregnancy. So if you take these precautions, the doctor will probably, after examination, may suggest an ultrasound, not only to confirm the pregnancy, but also to see the welfare of the fetus and also the progress. And as the term approaches, the number of visits will increase, and so will the number of ultrasound examinations also. One also has to decide about who is going to take care of the newborn, and this is a very, very important decision, because after all, you're working towards the birth of a healthy child, and you want that baby to be taken care of in a facility where, if anything goes wrong, there will be well-trained doctors looking after the baby. So pregnancy is a responsibility. It's good news, it's happy news, but there are some precautions that you have to take. I have explained most of them right now. Of course, you can discuss this with your obstetrician in greater detail, and in the next clip, I hope to tell you about what to expect when the newborn arrives and subsequently. I hope this little clip has been useful to you. I'll be bringing you some more clips.